An HMO health insurance plan. Let's talk about that because HMOs, they are growing in popularity amongst the group provider as well as the Medicare side of health insurance. An HMO stands for Health Maintenance Organization. And what HMOs essentially are is they are a tight-knit network of providers that offer a highly discounted rate for seeing those in-network providers. However, if you have an HMO insurance plan and you want to go see an out-of-network provider, odds are you will be bearing the full cost for that visit or paying the full cost for medical services. The best example I can give of an HMO insurance plan is, let's say your primary care doctor, they are considered in-network by the insurance company, and you have a $10 copay when you go see that primary care doctor. However, a specialist you really want to see, let's say a cardiologist, is not considered in-network with an HMO plan. Well, if you go see that specialist, you may pay the full cost for that visit. A lot of people ask me, Sam, do I need referrals for a specialist? And what role does my primary care provider play in an HMO plan? I like to think of your primary care provider as like the quarterback. They're the one that coordinates and distributes your coverage on an HMO plan. So on a lot of HMO plans, you will need referrals to see a specialist. You just can't walk in the doctor's office and say, I want an appointment with your finest cardiologist. Your primary care doctor will need to send a referral to the specialist's office. And the specialist's office also needs to be in network for you to get that highly discounted rate. So when people ask me, what role does my primary care doctor play in my HMO plan? Your primary care doctor is really your coordinator. Again, the quarterback. It's everybody that's going to coordinate your care and help you get access to the care you need. Even if your HMO plan says they don't require referrals to see a specialist, we highly recommend that you try to get one from your primary care doctor or your presiding physician. That way you can get into your specialist quicker, because with a referral, a lot of times you'll be able to get into a different doctor's office quicker than if you just walk in off the street. A lot of the limitations with an HMO plan is the referrals as well as the network. That's why it's really important, if you're choosing to go with an HMO plan, you talk to your trusted insurance advisor, hopefully a Senior Benefits Plus advisor, and they help you coordinate who's in and who's out of network.